Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Aisha Rashid, your instructor of microbiology. Today I am here with the new topic of our syllabus, which is microbial diseases. We will cover up some common microbial diseases under this session, and this discussion comes under the series of lecture, which is lecture number 23. The first and the most common microbial disease which is mostly encountered is tuberculosis, simply known as TB. We will discuss this TB in detail. TB, tuberculosis. TB is an airborne disease, means it is spread by its organism is spread by the air, by air. So that is why it is called as airborne disease. It is caused by the bacterium Mycobacterium tuberculosis. This Mycobacterium tuberculosis is its causative agent and it can be spread by the air from one space or one way to the other way. This Mycobacterium tuberculosis is also written as M. tuberculosis. You know how to write the names of microbes. I have told you earlier. The first letter, which is M, Mycobacterium, that is written capital, and the second one T, it is written small, and whole name Mycobacterium tuberculosis is written in italic font. Over 9 million new cases and 2 million deaths per year worldwide happens because of this TB. You can estimate from this figure how much severe TB is. Up till now, 9 million new cases are reported over the world. One third of the world's population is infected by Mycobacterium tuberculosis. So this is very much spread. Mostly it is spreaded in the underdeveloped countries or developing countries. Developed countries have overcome this TB, but it is mostly proliferated in underdeveloped countries. Now the transmission of the TB. TB is spread from one person to the other person through air. In first slide, we have seen that it is an airborne disease. You can see here in the figure, if one person infected with the Mycobacterium tuberculosis, it will spread the germs via breathing from the nose, and these red dots or red particles are denoted by the red dots, or these are showing the Mycobacterium tuberculosis. Now you can see this much area of the air which is heavily infected by the Mycobacterium tuberculosis, and air will carry these particles to the other places and will infect other persons. So that is why we are saying that TB is an airborne disease. TB is spread from one person to the other person through the air. The dots in the air present droplet nuclei containing tuber, tubercilli bacilli. So these contain these nucleated particles which are called as tubercilli bacilli, which are the causative agent. Now, what are the causes of TB? Why it happens? Mycobacterium tuberculosis is this bacterium is highly aerobic. This is aerobic, means it exists in the presence of oxygen. It infects the lungs. This TB infects the lungs. It divides very 15 to 20 hours. Every passing 15 to 20 hours, the Mycobacterium tuberculosis is divided, and one particle becomes divided into two particles. This Mycobacterium tuberculosis is unable to be digested by macrophages. Macrophages cannot digest this TB. This is the basic factor that our immune system cannot overcome this TB, because the macrophages, the T cell, the helper T cells, which are the soldiers of our immune system, they cannot engulf these tuberculosis particles. Very resistant to many disinfectants, and it is also resistant to many disinfectant, like this tuberculosis is resistant to acid, it is resistant to alkali, it is resistant to drying as well. contagious spread through the air. This its spread is very much airborne, and it is very contagious, can spread from one person to the other person by inhalation of the infected person, or inhalation of airborne bacteria from the infected person. It is easier to contract with weak immune system. Weak immune system persons are most prone to be infected by the TB. Now, what are the symptoms of the TB? The most common symptom of the TB is the cough. If you have encountered any TB patient, they are mostly coughing. They are coughing again and again, and they have continuous coughing, even sometime with the bloody sputum. The loss of appetite happens in the TB patients. There is the fever, there is loss of energy, there is loss of weight, there is night sweats as well. These all are the symptoms of the TB. It could spread to the other parts of the body, causing other symptoms. It may spread from the lungs to the other or vital organs, and it can cause the other infections as well. Now the diagnosis, how the TB is diagnosed, you can see from the picture as well. There is the skin strip test, and there is also a blood test. So skin test can be performed by a skin tuberculosis detection strip, or there may be the chest x-ray to check the congestion or to check the level of the sputum, or there is the analysis of sputum as well. Now, treatment and prevention. Positive skin test or the negative x-ray. If there is the positive skin test, or in the x-ray there is too much sputum, which is referred as negative x-ray, in case of this positive skin test, there is recommended antibiotic isoniazid. There is the course of this antibiotic isoniazid. Patient has to take up this course. Then if the in case of positive skin test and positive x-ray, there is the antibiotic, there is a combination of rather antibiotic, which is isoniazid, rifampin, ethambutol, and pyrazinamide. The combination of these antibiotics is taken, and the whole course is completed. Now, what is the prevention? How we can prevent the TB from happening? Before the exposure to this very particle, there is a vaccine, BCG vaccine, called as, which it is very common and it is easily available in the market. The BCG vaccine will help to you can see the prevent the TB. Now you can see here is the X-ray before and after TB. These white levels are showing the level of sputum. Now the prevention. Tuberculosis prevention and control efforts primarily rely on the vaccination of infants and the detection and appropriate treatment of active cases. The first one is its prevention. In prevention, there comes the vaccine. We have said that, and from infants' age, it is started from infants. The vaccine, you can see the babies are vaccinated or infants are vaccinated so that they cannot have the exposure to, or they can resist to the causative agent of TB. In case of detection, there must be an appropriate treatment. There must be an appropriate treatment of active diseases or active cases. WHO, the World Health Organization, has achieved some success with improved treatment regimes and small decrease in the numbers. There are a number of efforts of WHO for the prevention. WHO has many teams and many courses of vaccination in underdeveloped countries. It also offers the treatment and prevention so that the spread rate can be minimized. Now the vaccine, the only available vaccine as of 2015 is Bacillus calmette-guerin, which is commonly called as BCG vaccine. This is the only vaccine available against the TB. In children, it decreases the risk of getting the infection by 20% and the risk of infection turning into the disease by nearly 60%. So if infants are vaccinated by this BCG, there is the 20% decreased risk of infection. And in case of a disease, there may be nearly 60% risk that they can be cured. It is the most widely used vaccine worldwide, with more than 90% of all children being vaccinated. This is a great success that 90% of children worldwide are vaccinated with this BCG. The immunity it induces decreases after about 10, but this immunity induced decreases after about 10. That it after 10 it happens this. Then there comes the epidemiology. Epidemiology means, I think you are familiar, I will tell you. Epidemiology is the spread of any disease or any, you can see the microorganism in the community. Just like COVID in nowadays, this is a pandemic, this is all over the world. Just like that, if any disease is common in the community or spread in the community, this is called as epidemic. So the study of this epidemic disease is referred as epidemiology. Tuberculosis is the second most common cause of death from infectious diseases, and it mostly happens in underdeveloped countries. After those of HIV and AIDS. After HIV or AIDS, this is the most causative disease of deaths. So this is very much dangerous. The total number of tuberculosis cases has been decreased since 2005, while new cases have been also decreased since 2002. So WHO's efforts are here mentionable in terms of vaccination and treatment. That is why their spread rate and their cure rate is increased. Sorry, the spread rate is decreased and cure rate is increased. China has achieved partially dramatic progress with about an 80% reduction in TB molarity rate between 1990 and 2010. The number of new cases has declined by 17% in the China between 2004 to 2014. So this is the great success of China, that China has overcome its epidemiology and spread. Tuberculosis is more common in developing countries. About 80% of the population in many Asian and African countries test positive in the tuberculin test. So this is the most common disease of Africa. I have met a person couple of days before. He is our national hero, our national soldier of armed forces, and he told me that under UNO's mission, he is working nowadays in Africa, and he said that there was one person. He says he get infected after every 2 months by this TB. So the tuberculosis is more common in developing countries. About 80% of population in many Asian and African countries especially test positive in tuberculosis. This was about the first common disease of microbial disease, that was TB. Now the second common and most important and infectious disease of microbe is HIV or AIDS. What is HIV? HIV stands for Human Immunodeficiency Virus. Human Immunodeficiency Virus, an RNA-based virus that causes AIDS. This human immunodeficiency virus is an RNA virus, and it causes a disease which is referred as AIDS. AIDS stands for immunodeficiency syndromes. Mean in this, the immune system is heavily compromised, heavily deficient. Immune system collapse or immune system fails, and patient prone to susceptible to every disease. Attacks the human system. This HIV, human immunodeficiency virus, it attacks the immune system. It destroys the body's defense against diseases. Now body becomes vulnerable. Body becomes vulnerable to the infections and cancers that don't normally develop healthy people in the healthy people. So overall mechanism is that immune system is very much affected and body become vulnerable or susceptible toward every disease, so patient suffers a lot. What does HIV look like? Here you can see HIV capsule. This is somewhat diamond shape, or and you can see there are the some spikes or this shape kind of structures are present on the surface of this capsule. Now the detailed structural biology of HIV. We have said that it is an RNA virus. So its diameter ranges from 100 to 120 nanometer with a spherical morphology. It is cone shaped. It is cone shaped and core surrounded by the lipid matrix. This lipid matrix contain key surface antigens and glycoproteins. You can see here there are the surface glycoproteins, this spike shape. This is enveloped surface glycoproteins. So viral core contains two copies of genomic RNA. Here you can see this is one RNA, this is two RNA, this is genomic RNA. And viral core contains two copies of genomic RNA reverse transcriptase, which is integrases and proteases. Two key parts of immune system are there. Human, if we talk about the human immune system, there are two key parts: T lymphocytes, which are T4 and CD4 cells, while antibodies are also the defense mechanism. So in defense mechanism or immune system, T4 and CD4 cells are there and antibodies are there. Healthy T cells and infected T cells. Here is the difference between healthy T cell. This one is very much healthy T cell and this is HIV infected T cells. T cells are particularly important in adaptive immune system. These cells help suppress or regulate immune responses. Now, how this human immunodeficiency virus transmission happens? Its transmission requires infected body fluids. It is transmitted from the infected body fluids, like it is transmitted by the infected blood. If it is transmitted by the sexual fluid, mostly you have seen that, and they see that they say that uh, don't use syringes or don't use the razors again, so that this HIV cannot be transmitted. It's for its transmission, its entry into the body is very much necessary, and it enters into the body by the body fluids. Now, infected body fluids. Four fluids, if infected, can transmit HIV. Here is the detail of the fluids which can transmit HIV. The first one is blood. I have told you a blood transfusion, surgical instruments, razors, commonly sharing blades or syringes, they can be the cause of this transmission via blood. There may be the semen in case of the sexual relation. There may be vaginal secretions, or it can be spread by the breast milk from mother to infant. If these enters in the body, then definitely HIV infection happens. Which fluids are safe? For the fluids that cannot transmit HIV, it comes saliva. It is not transmitted by the saliva. It is not transmitted via urine or pee. It is not transmitted via sweat and via tears. These are the body fluids which are safe. They don't have the HIV. Now, HIV transmission. Three most frequent ways to get infected by the HIV are unprotected sexual intercourse or injected drug use like sharing of common syringes or from an infected mother to infected to her infant. These are the common transmission modes. Means it is spread by the sexual relation between partners. It can be spread via the drug use, injected drugs or drug use, or it can spread from mother to infant. Other much more rare way to get infected is blood transfusion. Blood must be tested and it must be HIV negative. Organ transfusion like kidney or liver transplant that can also be happen uh, cause of HIV transmission. Healthcare settings can be the you can say the part of this spread, like if they are using the common surgical tools, they are not caring about or bothering about the using of common syringes, so the healthcare settings can be very much important regarding this transmission. Now the symptoms of HIV. HIV infection has many, you can see the stages before the last stage of AIDS. Chronic stage consists of, in case of chronic stage, there may be the diarrhea or other bowel changes, there may be fatigue, there may be fever, loss of appetite, or unexplained weight loss, dry cough, and shortness of breath, night sweats, and the swollen lymph nodes in the neck or groin. There may be the night sweats. There may be the swollen lymph nodes in the neck, and there may be the confusion or difficulty on concentrating, or personality changes may be there. Respected outbreaks of the cold sores or the genital herpes sores may be there. Tinglings or numbness or weakness in the limbs, mouth sores, or the yeast infection of the mouth can happen. Now, what is the treatment in case of the AIDS? There is no treatment, there is only the prevention. Only symptomatic treatment can be given to improve the patient's quality of life. The most effective treatment for HIV is highly active anti retroviral therapy, which is very highly active. A combination of several antiretroviral medicines that aims to control the amount of virus in your body. Other steps that can be taken include keeping immune system strong, taking medicine as prescribed, and monitoring your CD4 cells, which were the white blood cells, counts to counts to check the effect of virus on your immune system is the best way to live longer with HIV. So there is no exact cure, only the life quality can be improved. Diagnosis. Diagnosis is done by testing a person's blood for the presence of antibodies to HIV. So if there are some antibodies to HIV, then it means that there is the virus that exists. Antibodies are generally not detectable until 3 to 6 months of following infection. So that is why it is mostly diagnosed at later stages. ELISA test is there, and Western blots are generally used to test the HIV antibodies. Now there is also the polymerase chain reaction PCR, also performed for the diagnosis of this AIDS. It looks for the HIV DNA in the WBCs of a person. In this polymerase chain reaction, WBCs are checked out and their polymerase chain reaction is carried out. PCR amplifies tiny quantities of the HIV DNA present. Each cycle of the PCR results in doubling the DNA sequence present. The DNA is detected by using radioactive or biotinylated probes. This is also the process of polymerase chain reaction. Once DNA is amplified, it is placed on nitrocellular paper and allowed to react with a radio-labeled probe. A single-stranded DNA fragment unique to HIV, which will hybridize with the patient's HIV DNA if present. So radioactivity is determined at the end. So this is the polymerase chain reaction in which you can say the virus can be detected at later early stages. Now, what is the prevention against AIDS? Practice safe sex to prevent HIV so that the body fluids cannot be transferred. Reduce your number of sex partners. Be confined to only safer one or the one. Talk with your sex partner or the partners about their sexual history as well as your own sexual history. Do not share intravenous needles, syringes, or cotton, cocaine, spoons, or eyedroppers with others if you use the drugs. Tell your sex partners or the partners about your behavior and whether you are HIV positive or not. Follow the safe sex practices such as using condoms. Do not donate blood, plasma, semen, or any body organ or body fluids or tissues if you are infected. Do not share the personal items such as the toothbrushes, razors, or the sex toys that may be contaminated with blood, semen, or the vaginal fluid. So this was about the HIV. So today's discussion covers up two diseases, major and the most common. The first one was TB, and second one was HIV. We have seen the causative agent of TB, prevention, treatment, diagnosis, and we have also gone through the AIDS, HIV, the causative agent, diagnosis, prevention, treatment, all the discussion about these two microbial diseases. If you have any type of query regarding these, you are more than welcome to ask during the live session. Thank you so much.